The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 distinct extracts. In each extract, a healthcare professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 through 12. You hear a physician talking to a new patient called Bernadino. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, doctor. I am Bernadino.
Good afternoon. May I know what your problem is?
I am having a severe stomach ache.
What do you feel?
I have heartburn and severe pain, doctor.
Since when have you been feeling this acidity and pain?
For the past 2 months. My stomach hurts after every meal. The pain persists even during nights.
Have you eaten any heavy food or something different in the last 2 months?
No, actually.
How severe is the pain? Let's say on a scale of 1 to 10, how would you scale the severity of the pain?
Well, I can say between 4 to 5.
Is the pain continuous?
No, it hurts only fleetingly.
Do you feel the pain after meals?
Yeah, probably, because it hurts every time after I eat.
Is there any kind of food that bothers you much?
Yeah, greasy food.
Oh, I see.
Yes, at home we eat a lot of greasy food.
Where in the abdomen does it hurt? Tell me the exact point. Does the pain shift to your chest, shoulder, back, or across your abdomen?
It hurts in the middle. At times the pain moves across my abdomen.
Besides the pain, you said you have heartburn?
Yes, I feel a kind of sour taste whenever I burp.
Do you feel like this more during the day or in the evenings?
Both. I feel the acidity during the day and at night.
Is it getting worse whenever you lie down?
Yeah, I get an acid-like taste in my mouth.
Besides greasy food, are you getting some irritation in your stomach when you eat any other kind of food, like spicy food?
No, actually, we don't eat spicy food at home.
And tell me, how frequently do you have a bowel movement?
No, it hasn't changed. It's regular.
And tell me, how frequently do you have a bowel movement? And has there been any change in your bowel movements for the past 2 months?
Yes, it has become a little bit softer.
Is there any change in the color?
Yeah, it is greener.
Greener and not darker? Any blood in your bowel movement, or is it darker?
Not darker. And there wasn't any blood in my bowel movement.
Okay, let's first diagnose your abdomen to check from where the pain comes. You said you are feeling pain at the middle part of your abdomen.
Correct.
Does the pain stay there only, or does it move somewhere else?
It usually stays there.
Do you feel acidity and heartburn during the pain?
Yeah, you were right.
Do you have vomiting or nausea?
No, not now.
What did you eat today?
I ate meat and tomato sauce.
Do tomatoes give you any trouble?
Not exactly. I've been eating tomato sauce always.
Do you get any trouble when you have orange juice?
Yeah, at times.
How do you feel then?
I get a strange metallic taste.
You do not feel acidity then?
No.
Now, tell me, what do you do whenever you get stomach aches?
I take Alka-Seltzer at times. That gives me a relief from the pain to some extent.
Yeah, that should help with the relief. Do you take any Maalox, Tums, or Mylanta?
No.
Have you ever taken any medication on a consistent basis, such as Advil, aspirin, or Motrin?
I was taking Tylenol usually.
Okay. As I told you earlier, I'm going to examine your feces to investigate whether you have any kind of parasite. Tell me, Do you either come from the tropics, or have you ever been traveling to any of the tropical regions or overseas?
Yeah.
Parasites that are found in most of the parts of the world affect the stomach. Besides, I want to check for any occult blood. You have mentioned earlier you haven't seen any changes in your feces, and it's only greener and not darker. Sometimes, if you have a hemorrhage in your stomach, then the digested blood could produce a chemical reaction so that you can have occult blood in your feces. In such cases, we don't see the red color or dark color of the digested blood. Therefore, a diagnosis is essential. Moreover, I would like to diagnose your upper gastrointestinal system through x-rays and contrast. You will be given a thick substance to drink, and then the radiologist would observe how your liver digests the substance and observe your stomach movements. Because I think that your pain comes from your gallbladder and not from your stomach, I will have to do this kind of diagnosis. After a thorough investigation, let me decide whether I should take the x-ray test or an ultrasonic study of your gallbladder. Do not eat any greasy food for now, and also do not have your dinner just before going to bed, because it could produce more acidity. Eat normal food and nothing spicy. I shall get back to you as I receive your medical reports from our lab. Anything else?
With so many medical tests, I'm afraid I have an ulcer.
I, too, have that kind of doubt. That is why I have suggested all these tests. I need to explain to you that an ulcer or other irritations in your upper intestines cannot be detected by x-ray at times. If the pain continues after having some antibiotics, you may have to go for an endoscopy. An endoscopy is a medical investigation in which a tube will be inserted through your mouth or nose, and then the specialist will observe your stomach, from the small intestines to the large one, and your gullet. Do you need any clarification?
No, doctor, thank you.
Good. Let us meet next week. Goodbye.
Extract 2, questions 13 to 24. You hear an optometrist talking to a patient called Dominica. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Dominica. How can I help you?
Good morning, sir.
Can you show me your registration card? Or should I search your details through your mobile number?
I think that would be better. My mobile number is 078-823-78979.
Okay, I've tracked your record. You last visited on the 27th of August, 2016.
That's correct.
Just pay the doctor's consultation fee here.
Sure, this is my card.
Please take your seat and feel comfortable. Should I help you with water, newspapers, etc.?
Thank you. Hello, doctor.
Hello, Mrs. Dominica. So how can I help you?
I just came for a regular checkup for a suspected case of glaucoma. 18 months ago, Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma and after examining my eye. He told me that my optic nerve is thicker than the usual.
That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and OCT today. And once you receive the 2 test reports, let's meet again in the afternoon.
Okay, doctor.
Yes, Mrs. Dominica?
Hello, sir. The doctor advised me for these 2 tests.
Okay. The 2 tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you?
That's fine.
Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Mrs. Dominica. I hope you had a good experience going through those 2 tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quickly, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually. They're called floaters. As we age, floaters develop to different extents. They're not harmful. Actually, floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs that the vitreous gel is pulling on the retina that can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely. Floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take a vitamin A supplement that includes selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer, A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at question 25. You hear 2 doctors discussing the topic of keeping the immune system under control. Now read the question.
Doctor, could keeping our immune system under control be as easy as managing our diet?
Well, for instance, the immune cells involved in multiple sclerosis mainly depend on sugar to activate the disease. However, the common drug for multiple sclerosis, dimethyl fumarate, blocks this energy pathway. Contrarily, these energy pathways are feasible targets to treat certain diseases that might extend to dietary measures. I'd like to be extremely cautious about this because nowadays diseases and diets have become very common. However, the theory that energy metabolism is crucial in the way the immune system reacts suggests that there are possibilities that different kinds of diets are going to have impact on our immune system that we're just starting to understand but are yet to understand it completely. I wonder at some stage if the autoimmune diseases like multiple sclerosis may include diet as part of the disease management strategy, as well as other diseases where immune system and energy metabolism are essential, such as cancer.
Question 26. You hear physicians discussing the topic of coping with a peanut allergy. Now, read the question.
Hello, doctor. What should parents do as peanuts have become an allergic substance nowadays?
It is really a very frightening factor to know that peanuts can cause allergic reactions, with increasing reports of sudden death in children following peanut ingestion, and new products are being launched on the market to help parents stave off a peanut allergy in their children. What I feel is, feeding peanuts to children doesn't require any specialized products. Right now, we have the strongest evidence that kids are at high risk because they have a severe egg allergy or eczema, and the dietary guidelines suggest that infants with severe egg allergies or eczema should intake peanuts as early as their 6th month. What I feel is, introducing peanuts to infants with moderate or mild eczema or egg allergies in a developmentally and culturally appropriate method would probably help prevent peanut allergies for the rest of their lifetime. Since peanut allergies are increasing rapidly, the early feeding strategy is something that the parents should consult with their pediatrician, as it is one of the best sources of protein.
Question 27. You hear the discussion between physicians on the importance of food challenge. Now, read the question.
Hello, doctor. Why are food challenges necessary?
Following the recent death of a 3-year-old child that had a food challenge test, a new study of over 6,000 food challenges done found the safety profile very reassuring. Food challenge tests are the mainstay of food allergy diagnosis because other diagnosis procedures are not that precise. We have blood tests and skin tests for food allergies, which carry a lot of false positives. Therefore, in many instances, we do have to perform a food challenge test when the diagnosis becomes doubtful. There are a number of people walking around with diagnosis of food allergies who are actually not allergic to that food.
Question 28. You hear a discussion between doctors about fake Stop the Bleed kits. Now, read the question.
Doctor, how do we get rid of the imitators of Stop the Bleed kits?
Stop the Bleed is a national campaign to increase awareness and provide training and kits to help the people witnessing traumatic bleeding. However, we must be very careful when obtaining the kit for our locality. The genuine kits are really very expensive, that may cost from $50 to $100 depending on the contents. However, there are some counterfeit tourniquets which are knockoff products. I would warn everyone that a tourniquet is meant for controlling acute arterial hemorrhage will cost about $25 to $35. Therefore, if you're getting them for a lesser amount, you probably won't get the best one.
Question 29. You hear a physician explaining to his nurse about causes of obesity. Now, read the question.
Doctor, could the bacteria in our guts impact the development of obesity?
We often see children eating the same diet and living in the same environment differ in their weight. I feel that there's an interaction between genes and the bacteria in our guts that may be the culprit. The findings suggest that it isn't just the components of the diet, but it's the interaction between the diet we eat, our genes, and our bacteria in our body. Every kind of different diet would cause obesity in an individual who is predisposed to becoming obese. Certain genes colonized with bacteria that are efficient enough to produce more nutrients for the individual, resulting in obesity.
Question 30. You hear a physician briefing staff about the herpes virus infection. Now read the question.
Typically, the herpes virus infect the genital or oral mucosa. They affect the mouth, causing cold sores or blisters that form on the mouth, lips, or gums. There may be a prodrome prior to the blister development, with a burning, tingling, or itching sensation in the infected. Throughout the lifetime, the virus remains dormant in the nervous system, hence the cold sores, which often reoccur in the same part. When it infects genital parts, it is called a sexually transmitted infection. The symptoms are similar to the oral infection of the virus. With the first outbreak, an individual may experience nonspecific flu-like symptoms like swollen lymph nodes, muscle aches, and a headache. There's also a possibility of having the infection without any signs or symptoms.
That is the end of Part B. Now look at Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fit best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a senior physician to junior doctors on risk factors of osteoporosis disease. You have 90 seconds to read questions 31 to 36.
Osteoporosis increases danger of broken bones. Hi guys, today I'm going to explain to you about osteoporosis disease, which makes the bones weak and break easily. According to a finding, binge drinking may increase the chance of getting osteoporosis in later life. The findings show that drinking too much alcohol over a short duration may impact genes involved in bone formation. Binge drinking occurs when a female has at least 4 alcoholic drinks in a hurry. However, for males, binge drinking occurs when he has 5 drinks in a short duration. America's Substance Abuse and Mental Health Services Administration indicates that binge drinking begins normally when a person is about 13 years old. Research involving adolescent laboratory rats was carried out to study the effects of binge drinking on their genes. They injected alcohol into the rats that resulted in a blood alcohol level of 0.28. In many American states, legally, a person is considered drunk when the alcohol level in the blood reaches 0.08. Some rats were injected with alcohol once a day for 3 days. The alcohol affected 300 bone-related genes in those rats. The other rats were injected with alcohol daily, but the injections continued for 4 weeks. In such cases, 180 genes were affected. The injections included ribonucleic acid to the genes of some rats, while the other rats, the RNA in the genes, decreased. Ribonucleic acid instructs the gene how to make proteins, the substances needed for bones and other tissues. Therefore, the change impeded with the molecular pathway that is accountable for bone construction. One of the most agonizing findings came 30 days after discontinuing the injections. That time, the rats yet showed differences in the way their genes were expressed. 30 days of a rat's life are equivalent to 3 human years. It is not essentially correct that what happens to the genes of rats will happen to human genes, but the findings suggest that binge drinking of alcohol by young people could indicate problems in their future. Bones are living tissue that continually break down and then rebuild themselves. However, as people grow older, the breakdown of bone is more than the reconstructed bones. As a result of this phenomena, small spaces inside the bone get larger, making it hollow, and the bone shell gets thinner. The term osteoporosis means porous bones or weak bones. By removing calcium and other essential minerals from tissue, osteoporosis harms bones. 8 of every 10 osteoporosis patients are females, and it is very common in Caucasian females over 50 years. Before developing osteoporosis, the patients experience a condition called osteopenia. Timely treatment can prevent this condition from developing osteoporosis. Osteoporosis and osteopenia can be detected by measuring the mineral density of the bones of the patient. Here, density means the strength of the bones. There are a number of ways to measure bone mineral density. The hip, spine, or backbone is used to examine the bone mineral density. A diagnosis called dual energy X-ray absorptiometry is the best method to diagnose osteoporosis that involves the use of X-ray radiation that lasts only a few minutes. Peripheral bone mineral density test is another method to measure bone density that is often used in the U.S. to examine if the patients are at risk of osteoporosis. This test costs less than the dual energy X-ray absorptiometry test. However, peripheral testing measures only one part of the body, and it is usually the heel, the wrist, or the bones between the finger joints. However, a shortfall of this test is when the patient has normal bones in the tested areas and has defective bones in other parts of his body. Then it cannot detect the disease. Therefore, often the peripheral test can show normal results of the patient who has osteoporosis in their backbone or hips.
Initially, the disease decreases the mineral density in the spine bone.
The mineral density of the bones of all parts of a woman is almost similar when she reaches 70 years of age. In such cases, the bone mineral density diagnosis of lower cost may not have precise results. Individuals over 50 years of age should intake 1,200 milligrams of calcium per day and 800 to 1,000 international units of vitamin D. Vitamin D2 as well as vitamin D3 are good for bones. Milk and milk products, fish with soft bones like salmon and dark green leafy vegetables, orange juice, bread, and cereals are rich in calcium. However, one should be very cautious about the intake of calcium. It should not exceed 2,500 milligrams a day, including calcium from foods and all other sources. Too much calcium can result in kidney stone disease. Vitamin D absorbs calcium. There are many drugs to treat osteoporosis, of which bisphosphonates are the most popular. Fosamax, Actonel, and Boniva are products of this group of drugs.
Now, look at Extract 2, questions 37 to 42. You hear the brief instruction given by a physician to his staff on the abnormalities in thyroid functioning. You have 90 seconds to read questions 37 to 42.
Thyroid function. The thyroid is a tiny gland in the lower front part of our neck that is responsible for regulation of many of the body's processes, such as energy generation, metabolism, and mood swing. The two hormones secreted by the thyroid gland are thyroxine and triiodothyronine. If the thyroid gland does not secrete enough hormones, one may experience symptoms like lack of energy, weight gain, and depression, which is called hypothyroidism. However, in case the thyroid gland secretes too many hormones, one may experience weight loss, increased anxiety, tremors, and a sense of being on a high. This is called hyperthyroidism. Hypothyroidism. This is a condition which is classified by a decline in the thyroid hormones in the blood. It majorly occurs if the patient is suffering from underactive thyroid or glands that control the thyroid functions, though there are other various factors that can result in this condition. Typically, hypothyroidism affects females more than males and worsens as they age. Let me now explain to you the common causes that could result in a decline of this hormone, giving rise to hypothyroidism. The Hashimoto's disease is an autoimmune disease that attacks the tissues of the thyroid gland. Often, females suffer from this particular autoimmune disorder more than males. That can possibly be due to an underlying genetic link. The thyroiditis is such a condition where the thyroid gland remains inflamed, resulting in less secretion of thyroid hormone. Often this condition affects pregnant women, and usually this phase is followed by a hyperthyroid phase that remains up to 6 months. The radioactive treatment for hyperthyroidism can always lead to an unpleasant outcome, underactive thyroid or hypothyroidism. The possible reason is that the therapy might have considerably eroded the gland to secrete enough hormone for an optimal functioning. Usually, following a radioactive treatment, the thyroid gland always becomes underproductive for a few months. However, if the gland completely stops functioning, then the condition can be identified as hypothyroidism. The malfunctioning of the other glands can also result in hypothyroidism. For instance, a malfunctioning hypothalamus or pituitary gland can result in hypothyroidism. At times, certain medications taken to treat hyperthyroidism can also result in hypothyroidism. Often a diet that is low in iodine becomes a major cause of hypothyroidism in adults. Significantly, the regions with poor iodine resources can have a greater number of hypothyroidism patients. Hyperthyroidism. In the hyperthyroidism condition, the thyroid gland becomes overactive and secretes abundant hormones in the blood. The Graves' disease is a common cause for hyperthyroidism. In the disease, the immune system is supposed to release antibodies that mimic the thyroid stimulating hormone and secretes abundant hormones that are released into the bloodstream. The nodules in the gland, as we age, lumps are developed in this gland that are non-functional or inactive. However, in some instances, these lumps start functioning on their own, secreting more hormone without the support of the pituitary gland. Certain medications taken to treat hypothyroidism can also result in hyperthyroidism. Thyroid enlargement is also a condition of hyperthyroidism that occurs due to any structural changes in the gland. The enlargement of thyroid gland is called goiter that can be unnoticeable as well.